I'm Dr. Fry. This is Seth Harrison.
Hi.
We're from the Center for Manual Medicine. And what we're going to talk about today is an ultrasound-guided, ultra-minimally invasive carpal tunnel release. So this is the way that you can have a carpal tunnel release without a scar, with only a Band-Aid when you leave, without all the damage that happens when you cut through the skin, and less chance of infection and less chance of damage. The ultrasound gives a wonderful view of the nerve and the arteries and the tendons that you can see so that you can do the operation in full view. So what we're going to do is use what we call a hockey stick to start with. And I'm going to have Seth look, and we're just going to find the nerve, okay? And the nerve is this big fat oval right here. And I can measure that and put a little arrow around it here and say, okay, how big is this? So it's 13, so it's it's a little enlarged. Do you have any numbness?
I do not.
Okay, so it's kind of large, it's at the borderline there. And you come off. Now, if I go forward, you can see that the nerve is getting deeper, and this is the carpal ligament right here, coming over, okay? Right over here is the ulnar artery and nerve. Carpal ligament comes right off of this bone right here, that bump I was talking about, the pisiform, comes right over the nerve. Here's all the tendons. So if Seth moves his hand, you can see that moving. If he opens and closes his hand, this nerve should be able to move around freely, which it's doing nicely, and it's not being compressed. If we come down into the carpal tunnel, go ahead, move around. It's still moving around freely, so everything looks pretty good. We can also look at the nerve lengthwise, okay, so here's the nerve right there, coming down into the carpal tunnel. And the nerve is coming down here. All right, so here's nerve, right? If you move your fingers, go ahead. You can see that the nerve moves a little bit, but the tendons move a lot. Okay, leave it there, open. And you can come down here. This is carpal ligament. Okay, this whole thing right here. It is often kind of modeled. Here's carpal ligament, here's nerve, it's under the carpal ligament. So here's where you would get squished or pinched. And then there's the end, okay? And if we come up here, here's the artery that you can see of the superficial palmar arch coming across. So you don't want to go that far. You only want to come up to here. Okay, so what we're going to do is use a little teeny knife that looks like a pen insert, about the same size, 2 millimeters, right? This knife was specially designed by a surgeon in Australia, and at the tip of it, it has a tiny little blade that can extend. So I can take this blunt tip and move forward, coming through underneath the ligament, and then extend the tip, put pressure from here, and pull back and cut from underneath. Usually takes a few passes of cuts to get through because it's a very dense ligament. The ligament has very few nerve fibers in the deep part, but as you get more superficial, the nerves become much more sensitive. So when you come from the skin, you're cutting through the sensitive portion of the ligament, and then you're cutting through the under portion, you're doing the least sensitive portion. So that's always an advantage. Let's take a look here, and we'll have Seth's hand here and talk about the difference between carpal tunnel technique. So a traditional carpal tunnel scar, all right, looks like this. So it follows the median nerve from the wrist here into the hand. So it's about 2 inches long. It's going to have sutures like this that are going to be in there for about 2 weeks, 10 days, 2 weeks, because the palm is a little slow to heal. There's good blood flow, but there's a lot of stress across the palm, so you let it in there. All right, so that's jammed up as a big bandage hand. All right, another way to do a carpal tunnel release is endoscopic. So they have a little scope like they put in people's knees, and the scar looks like that. So it's about 1/2 inch wide, okay? You're coming in with a scope. Unfortunately, you can only see right in front of you. You cannot see below, you cannot see beside. So it's actually a very dangerous way to do a carpal tunnel release, although it's less invasive. With ultra minimally invasive, you get a scar that big. Well, you don't get a scar because it's in the flexion crease, and within a year that will completely disappear. So you just have this tiny little 3 millimeter wide incision. Doesn't need a suture, just a band-aid. And then I would use the knife and come in from here. We'll draw the ligament. There's that bump right there, the pisiform. Here's this scaphoid tubercle. So we know it comes across here. Then it comes to this bump and a bump in the middle of your palm right there. So it comes across here. So this is ligament. And that ligament is not very wide. So I only have to go from here to here. I want to avoid this area up here where there's an artery coming down that loops over to the radial artery. So the ulnar artery and the radial artery connect in what's called the superficial palmar arch. So you only want to come down in between the median nerve, which is right on the line of the incision here, and the ulnar artery, which is right to the side here, comes like this. So you have a safe area, and the safe area is right here. You can extend through to the carpal ligament, push the knife up, put pressure from the top, and come back and cut the ligament from below. Take this thing out, pull it out, and you're done. You've got a tiny little hole there that you put a band-aid on, and you can go home. Call you the next day and see if everything's going well.